The autosomal recessive spastic ataxia of Charlevoix-Saguenay is characterized by early onset cerebral ataxia, spasticity, and peripheral neuropathy. It is the loss of function mutation with the SAX gene that is responsible for the abnormal bundling of neurofilaments and intermediate filaments in motor neurons and fibroblasts. Fibroblast cells modelize the ARSACS pathology, as the bundling of intermediate filaments is identical to the bundling of neurofilaments seen in motor neurons, making it an effective tool for testing. From this, we investigate the possibility of a therapeutic approach using HDAC inhibitors. Acetylation is the critical problem in ARSACS. Using a Western blot analysis, we compare the control MCH74 fibroblast cell to ARSAC fibroblast cells. The levels of acetylated tubulin and histone 3 are much lower in the untreated ARSACS condition compared to the untreated control. Treatment with a pan-HDAC inhibitor Sa-2 micromolar increases acetylation to normal levels. ARSACS patients' fibroblasts were used to test the effects of the pan-HDAC inhibitor Sa. The yellow arrow indicates clear bundling of vimentin in the ARSACS patients' fibroblasts. The pan-HDAC inhibitor is capable and sufficient in restoring the intermediate filament network. The percentage of cells containing intermediate filament bundles decreased following SAHA treatment. Knowing this, we hypothesize that the pan-HDAC inhibitor will have the same effect on ARSACS motor neurons and restore neurofilament network. ARSACS is a disease that affects motor neurons. Illustrated by the yellow arrow, we can see bundling of neurofilaments in the SACS knockout motor neurons. Looking at the fourth image of figure A, an amelioration in neurofilament network following a treatment with a pan inhibitor SAHA 2 micromolar is observed. The pan-HDAC inhibitor decreased the percentage of motor neurons with neurofilament bundles. Our next objective was to identify the most effective HDAC inhibitor for bundle resorption. HDAC6 inhibits tubulin acetylation. Tubastatin A, an HDAC6 inhibitor, will promote the acetylation of tubulin. HDAC1 and 3 inhibit histone acetylation. RGFP109 is an HDAC1 and 3 inhibitor, consequently promoting histone acetylation. To test the epigenetic effects linked to histone 3 from the Western blot, HDAC1 and 3 were inhibited using RGFP109. RGFP109 4 micromolar was applied to the SACS knockout motor neurons and had no effect on bundle resorption. The HDAC6 inhibitor tubastatin A was used on SACS knockout motor neurons and significantly reduced the percentage of neurofilament bundles. Tubastatin is most effective for bundle resorption in SACS knockout motor neurons and may be a valid therapeutic approach. Further testing on various ARSACS mutations are necessary to validate this claim. To summarize, acetylation is the critical problem in ARSACS. Tubastatin A, an HDAC6 inhibitor, is most effective in decreasing the percentage of motor neurons with neurofilament bundles and offers a promising therapeutic approach for the ARSACS cellular phenotype.